What should parents do when a child has a fever? When a child has a fever, parents should pay attention to signs and abnormal conditions and promptly take them for medical examination and treatment. According to today's Parent magazine, parents often worry about the potential harm of a fever to their child, especially if the child's temperature is high. However, in reality, a fever is a sign that the body's immune system has been activated and is fighting an infection. That is precisely what the immune system needs to do to protect the body. If you're concerned when your child has a fever, it's best to check their temperature. The most accurate way to measure the temperature of a child under 2 years old is to take a rectal measurement. Most thermometers will provide results within a few seconds, and the child will not feel uncomfortable when measured rectally. Typically, a high temperature of 38 degrees Celsius or above indicates that the child has a fever. Older children can have their temperature measured orally or under the armpit. In these areas, a high temperature is considered to be 37.5 degrees Celsius or above. If a child aged 2 months or younger has a fever, it is better for parents to take the baby to the nearest medical facility. Children at this age are at a higher risk of infection from more dangerous bacteria and should be examined and treated for fever as soon as possible. If your child is older and has a fever, you can give them a small dose of acetaminophen, 15 mg per kilogram, or ibuprofen, 10 mg per kilogram. After 20 minutes, recheck the temperature and assess the child's condition. If the child is playing, more active, and feeling better after taking the medication, parents can continue treating them at home for 2 to 3 days. However, if the child is unconscious, unable to drink, not breathing normally, extremely fatigued, or if the fever lasts for more than 3 days, it is best to take the child to see a doctor.